So on behalf of the students, faculty, and staff at Case Western Reserve University School of Medicine, I'm honored to be here to say a few words to you. We're absolutely delighted to have you in our city. And if you have time, we hope you'll visit the medical campus. Either this trip or in the future, we'd be delighted to host you. Case Western Reserve University School of Medicine is the largest biomedical research institution in Ohio, and we regularly rank among the top recipients of funding in the entire United States from our National Institutes of Health, which indicates the high caliber of work that we do here. But given the topic of the day, I'd like to spend a few minutes talking about the relationship between our work and the economic development and jobs we hope to bring to the city. Now, Cleveland used to be a steel city, but we're fast becoming a learning city, a teaching city, a services city. And what's coming out is that the future of Cleveland lies in meds and eds. And you can imagine that a school of medicine stands at the intersection of those two. And like the healthcare institutions in your own countries, our medical school is an economic catalyst. We're playing a major part in the renaissance of Cleveland. We're consistently a top 25 ranked medical school in the nation and a top 15 producer of the next generation of researchers. We and our affiliated hospitals, which are ranked among the best in the nation, bring over $500 million a year in grant funding into our city from external sources for biomedical research. Now, each new grant award from the National Institute of Health results in about 7 new jobs and an average salary of about $52,000 a year. Clearly, these are good jobs and jobs that can support families. But that's not all. This work creates a need for other jobs to support our research efforts, whether suppliers, professional services, or other related areas. Our medical school-centered research complex adds $2 billion a year to the local economy. Let me tell you a little bit about that research. At Case Western Reserve School of Medicine, our perspective is cosmopolitan, and a lot of our research is actually international in nature. This is significant because in today's globalized world, cross-national collaboration and partnerships are essential for improving the health of people worldwide. We have active research projects, most collaborative in nature, in many areas of the world, including such far-flung areas as Papua New Guinea, Kenya, Taiwan, China, Japan, Brazil, Uganda, Madagascar, Germany, and others, and educational collaborations in Brazil, the Netherlands, China, Peru, Costa Rica, Uganda, Papua New Guinea, Abu Dhabi, and more. I'd like to provide some examples of this important work. So one of our professors, Dr. Li, is conducting a 10-year longitudinal study to examine how an increasingly westernized diet and changing lifestyle affects the health of people in China, in Shanghai. Dr. Li and his colleagues are tracking health information and laboratory measures for 48,000 children and adults in the Jiabei Health District of Shanghai, making this one of the largest community-based investigations ever conducted. This work is yielding a goldmine of basic science and epidemiological information that will help us better understand how genetics, lifestyle, and environmental factors affect overall health, including heart disease and cancer. It'll also be invaluable for creating more effective disease prevention and treatment programs. In a second example, the Uganda Case Western Reserve University research collaboration began in 1986 and has conducted over 70 clinical and observational studies of HIV and tuberculosis prevention and treatment involving more than 25,000 adults and children in Uganda. Among these was the first AIDS vaccine trial in Africa, which began way back in 1999. More than 200 peer-reviewed publications and 400 abstracts have resulted from these efforts. We believe a lot of lives have been and will be saved as a result of this vibrant partnership. Additionally, our faculty members, working with their Ugandan colleagues, are providing extensive training to the country's young researchers and clinicians. And we have a track record of everyone who has come here to get their PhD or their doctoral degrees, everyone has gone back to Uganda to work. To date, this collaboration has generated over $185 million in funding from such sources as the NIH, the CDC in the US, the World Health Organization, and the Bill and Melinda Gates Foundation. And we're very active in battling other infectious diseases. Tragically, malaria remains a problem in many areas of the world. So a team of our researchers has created a rapid malaria detection device. Essentially, it looks like a red laser pointer, and it can detect the parasites, the iron particles that they generate in the blood, giving results in less than a minute compared to conventional microscopes, which can take hours. Some of the same researchers are contributing to the first phase of developing a vaccine for the Zika virus. They're also implementing an on-site device to track HIV treatment progress by measuring the T-cell count at a rate that's 1,000-fold cheaper than existing methods and requires less training to use. And there's so much more. I'd like to close with a brief description and a short video of a technology project we're very excited about here at Case Western Reserve. Technology, of course, is changing healthcare in a dramatic way. To take full advantage, we and our major affiliates, the Cleveland Clinic, are developing a nearly 500,000 square foot health education campus where medical, dental, and nursing students will learn together, including in multidisciplinary teams under one roof using the latest technology. Now, the new space isn't going to have any of the standard cadaver labs where students have long learned anatomy. That's the way it's been done for the last 400 years. Instead, our students will wear HoloLens headsets and use holograms to present the body's organs and systems in 3 dimensions. HoloLens was developed by Microsoft, and we're the only university among 30 organizations that partnered with the company in their pilot phases. Others were NASA, Japan Airlines, Volvo, Dubai Electricity, and the Water Authority. Let me close by saying, please contact me directly if you'd like to learn more about the projects I've touched on today, or any of the countless others our faculty members are pursuing. And when you return home, please tell the medical schools in your country about Case Western Reserve. Have them call or email me. We're always looking for new partners, and we're happy to share what we learn that can benefit others. Thank you very much, and enjoy the rest of your day.